In our world, everything happens for a reason and everything has a cause, and the study of the cause is called etiology. Now, in our video, we are going to discuss about the etiology of the ASD, Autism Spectrum Disorder. The etiology of the ASD is multifactorial, involving genetic and environmental factors. In genetic factors, two monogenic genetic cases and multigenic factors. Multigenic interactions are there in the genetic factors. Some genetic syndromes have higher risk of getting ASD. Example, X fragile syndrome, tuberous sclerosis, and duplication syndrome, Rett syndrome, like this. In this first fragile X syndrome, it is and tuberous sclerosis. It is caused due to the TSC, tuberous sclerosis gene 1 and or gene 2 impairment. So this leads to this disorder, and this disorder has high risk of getting ASD. And duplication syndrome. So these genes are affected in this duplication syndrome, and this also has a high risk to getting ASD. And Rett syndrome, it prominently affects the females. In this, MECP2 gene is affected, and it leads to the high risk for the ASD. These etiological studies are not only important in understanding the genetic interaction, it also helpful for the development of the new intervention methods and new diagnostic methods also. We'll discuss some of the gene and their functions. So these functions are related with the autism. So in the defect in the autism, these functions are lack. So first gene, SANK3 gene. So this gene is responsible for synapse formation and regression. So neuromuscular synapses are formed by this SANK3 gene. Then NRX-NI gene. So this gene is also responsible for the synapse formation. Then NLGN3. So this is also responsible for the synapse formation and synapse function. Normal synapse function is maintained by this NLGN3. Then MECP2. So maintaining the neuronal development. So neuronal development are maintained by this gene. Then fMRI. So cognitive development and some of the synaptic plasticity. So the changes in the synapse are happened by this fMRI gene. P10 gene. Synaptic development and cell proliferation. So these are all happened by the P10 gene. Then CHD8, so remodeling chromatin formation. So these are all signaling. These are all happened by the ZHD8 gene. Then FOXP1, so language development. So language, so it obviously develop our cognitive. So language and cognitive development is happened by this gene. Then in genome-wide association study, so multi-gene interaction are organized by these studies. So genome-wide association study, GWAS. In this study, some of the scientists are discovered in some point of the chromosomes is impaired, then the ASD have the high risk. So in this point, so have the impairment, then the person may have the high risk to getting the ASD, like CP21, 5P14, and 7Q35, 20P12, like these regions. So the chromosomes has affected, then the person has the chance to getting the ASD. And these locations are happened in some genes, CNTN gene, NRX-NI gene. So like these genes, these particular points are weak. So then the person has a high risk to getting the ASD. So these are all the genetic factors. Then environmental factor. So environment is affecting the child by two ways. First, by maternal way. So the mother is exposed to some environment and having the disease in the environment, and the child has a chance to getting environmental exposure in early developmental period. So this also leads to the ASD, and maternal environmental exposure also leads to ASD. So first, maternal exposure started with the medication, prescribed medications like anti-seizure medications and opioids. So this also leads to the ASD for the pregnant woman. So the fetus in the pregnant lady. And environmental pollutants like heavy metals, air pollutant like cement factories nearby there, and soil factories nearby there. So this air pollutant and heavy metals like lead, mercury are burning like this. So these metals are inhaled, and this also leads to the ASD for the pregnant woman. So in this, the fetus have the chance to getting ASD. And some infection like rubella. So these like infection and influenza virus. So these are all the etiology. And poor nutrition of the mother. Example, folic acid is nothing, it is a vitamin B. So vitamin B12. So these are all the causes of the maternal. So what happens in this? So the development of the brain and maturation of the brain, neuronal development, or lag in this exposure. So this leads to the ASD. Okay, then early developmental exposure of the child. So the child start to expose in the environment and their nerve is going to develop, and it leads to the more of the actions. So the child going to learn and child going to do something. So these are all happened by the neuronal development in the early period. So any interruption in this period, so the child is distracted or the child is not correlated with the environment. So any interruption in this, it will lead to the ASD. So the child may lack in the neuronal development. It leads to the ASD. So the child lack in social interaction and they have may some stereotyped behaviors. So by this, their processing skill, their connection with the environment, and their adaptation with the environment are all malfunction. So they are fixed and they have the routines like in the same way. So because their neuronal development is not there, so they are fixed. Okay dears, in our video we just discussed about the etiology of the ASD. So recent developments or we are discussed in our further videos what are the advanced diagnostic techniques for ASD we are going to discuss. So keep supporting us, we also need motivation. Thanks for watching. Bye bye.